Hey, Dr. Doug, Bodyworks Physical Therapy. Hey, this is our third take of our first virtual office. We're a little slow. I think we kind of have a little bit of a technological sickness. And you know what the prescription is? I think I need more cowbell. So we'll get the cowbell out. Yeah, I think that's going to be the prescription here. I'm going to give a shout out to Mike on that, who enlightened me to that whole thing, and then we'll say thank you to Lisa. There's yours, okay? All right, so today we're going to talk about neck pain and a root cause of neck pain. And is the neck pain the cause of it, or is there something else going on? Which leads me into my quote wall, which you see kind of my quote wall that I have the best patients here. They say the best things, and I write down these little snippets. I actually had a new one this morning that I'll probably say at a later time. But this is from Kayla, who's a cattle rancher. All right, Cowbell cattle rancher. She goes, I want to get my cow back fixed. She said that. I go, what? She goes, yeah, I want to get my cow back fixed. Her back was kind of rounded, didn't kind of like the way it looked, and she's having some, neck and shoulder issues. And I said, okay, well, let's work on it. So why don't you follow me into the room, and I'm going to give you some ideas on neck pain, and is it really coming from here, or is it coming from somewhere else? So follow me. All right. Okay, I've had 2 patients this week which just has this deep neck pain, but we're finding the problem is not here. That's just kind of the squeaky wheel. And the body has a lot of different pain referral patterns, and usually where the side of the pain is at is not the source of the problem. And what we see a lot of problems with is people doing this, is they slouch. Okay? You slouch, your head goes forward, and what it does is just pinches in there. Okay? So this is the tissue that gets injured, but the question is that the problem? No, the problem can be coming from right here in our core muscles. All right, you heard about the core, all these things here. And so what you want your core to be strong, so you can sit up straight, so your head's in a better position, so it doesn't, give these tissues problems. It's like this. Here's your core, okay? Your core should be a nice rigid cylinder. If I put this here and I put this book on it, see how much pressure pushing down that can take? What happens when your core's not strong? You do this. All right? Then you get these things, and then as my friend Paulie says, don't mess with my Muffin Tops. Anybody out there have a Muffin Top? Yeah, those things right there. So here's what you do for your Muffin Tops, okay? 2 things. One is planks, okay? Where you lay on your side, here and here, knees, hips, shoulders all straight. You're going to lift up and lift your hips forward. You're going to hold it for about 10 seconds. Keeps us in a straight line, works the right muscles. And bring it back down. Hips up and forward. Hold for 10 seconds. That works all the downside muscles. Then you flip. Do the other side. Hips up and forward. Works all these downside muscles to keep this nice and upright. Okay? The second thing you want to do, I'm going to show you a stretch in the doorway here. You all have doorways at your office. You stand in the doorway, elbows at shoulder height, right foot forward, and then lean. Okay? It does 2 things. It opens this up and it straightens this out so you don't get that hump on your back. Okay? And pinch all this stuff up in here. Okay? Come on back in here. So what we'd like for you to do is, I'd like to leave your comments regarding this video, regarding neck pain, your thoughts, ideas. And we'd also like for you to put some other comments of different talks you'd like to learn about, whether it be knee pain, back pain, hip pain, plantar fasciitis, elbow stuff. Let us know concussions. We see concussion patients here, so we appreciate that. And if you have any other questions, come see us at Bodyworks Physical Therapy, where we help you get to the root of the problem and not just treat the symptoms.